Have you ever contemplated why several seniors pass away gently in their sleep, devoid of warning, discomfort, or farewell? It appears serene, but is it genuinely so? Or is it the culmination of an unforeseen circumstance that eluded our notice each night? Thousands of elderly individuals close their eyes anticipating awakening, yet never do. Their families are left in a state of shock, confusion, and mourning, devoid of solutions. It is not solely attributable to advanced age. In some instances, there were indications of minor alterations and subtle cautions, although they were overlooked or disregarded. Your body communicates with you long before the conclusion arrives. It murmurs, then it cautions. Yet, if no one heeds, the quiet becomes eternal. This film will elucidate the genuine medical reasons behind the prevalence of seniors dying in their sleep and how to identify the warning symptoms before it is too late. Peaceful sleep should not remain enigmatic, as knowledge can be life-saving, perhaps even your own. Today, we will elucidate the 6 concealed factors contributing to the mortality of numerous older persons during sleep and the measures you can take to prevent becoming a statistic. These are not mere conjectures or myths. They are substantiated by empirical science, authentic narratives, and genuine warning signals that are frequently overlooked. Regardless of whether you are in your 60s, 70s, or beyond, this information could significantly impact your life or that of a loved one. The reality is that many of these insidious threats do not manifest abruptly. They accumulate gradually through subtle symptoms, overlooked medications, or minor alterations in sleep patterns that are often disregarded. However, this will no longer be the case after today. By the conclusion of this video, you will be able to identify the initial warning signs. Implement straightforward and efficacious measures to safeguard your health each evening. You merit repose devoid of anxiety around uncertainties. If this subject is significant to you, consider subscribing and enabling alerts. We provide life-saving guidance weekly. Now, let us explore the initial alarming reason many elders do not awaken. One quiet heart attack during sleep is one of the most frequently disregarded reasons of sudden nocturnal mortality among the elderly, often occurring without prior warning. A silent myocardial infarction during sleep, devoid of spectacular chest pain, arm gripping, or gasping for assistance. Merely a tranquil descent into irreversible unconsciousness. Joe, a 71-year-old retired fireman from Wisconsin, appeared as healthy as any man of his age. He walked every morning, laughed with his grandchildren, and volunteered at the local shelter twice a week. One night, after an entirely ordinary day, he tucked himself into bed beside his wife, kissed her goodnight, and never awoke again. Initially, everyone believed it was merely his time. However, an autopsy uncovered the reality. Joe experienced a myocardial infarction during his sleep. The family was further astonished to learn that he had exhibited symptoms in the weeks preceding the event. He reported experiencing increased fatigue, occasional heartburn, and intermittent feelings of malaise upon waking. However, he dismissed these symptoms as inconsequential, a sentiment echoed by others. Many individuals are unaware that heart attacks in older adults do not always manifest as depicted in films. Particularly during nocturnal hours, symptoms may be ambiguous, mild, or obscured by sleep. The American Heart Association indicates that older adults are more prone to experience fatigue, insomnia, shortness of breath, or mild indigestion in the days or weeks preceding a cardiac event. Not all heart attacks present with excruciating pain. In fact, approximately 50% of heart attacks in the elderly are deemed quiet, indicating that the damage is substantial, yet the symptoms remain unacknowledged until it is too late. During sleep, the body's functions decelerate, blood pressure naturally decreases, and the warning indicators become increasingly difficult to detect. Consequently, prevention is paramount. Individuals over 65, particularly those with a history of hypertension, diabetes, or hyperlipidemia, require regular cardiac evaluations. Consult your physician regarding the necessity of obtaining an ECG annually. Do not disregard any unusual fatigue, disrupted sleep, or even slight chest discomfort. Refrain from consuming heavy or fatty meals near bedtime, since these may provoke cardiovascular symptoms during sleep. Additionally, ensure that your blood pressure is adequately managed, particularly overnight. Certain individuals get advantages from nocturnal monitoring or altering drugs to enhance cardiac support during critical hours, as the distinction between awakening and not may hinge on a singular action taken the preceding night. Regarding nocturnal hazards, there exists another insidious menace that frequently remains unnoticed, although impacting millions of elderly individuals each night. Let us discuss it further. Severe sleep apnea, the nocturnal assassin that deprives you of breath, the second concealed peril that leads to numerous senior fatalities during sleep, is often misidentified as mere loud snoring. Nonetheless, it is significantly more grave. This condition is known as sleep apnea, which insidiously deprives the body of oxygen night after night until, ultimately, it becomes excessive. Carol, a 68-year-old retired librarian from Ohio. Her spouse often jested that her snoring could rattle the walls. However, with the passage of time, he observed something significantly more unsettling. Prolonged intervals between breaths, succeeded by abrupt gasps as if she were asphyxiating in her slumber. Initially, he dismissed it. Carol had consistently been a deep sleeper and had never voiced any concerns. However, one morning, she failed to awaken. Upon the arrival of paramedics, no immediate cause was identified. Her heart ceased functioning throughout the night. Subsequent examinations indicated she suffered from severe obstructive sleep apnea that had remained entirely untreated. Sleep apnea is remarkably prevalent among older adults, particularly those who are overweight, hypertensive, or diabetic. The hazard lies in its disruption of the body's availability to oxygen. Each instance of respiratory cessation, which may occur numerous times throughout the night, compels the heart to exert greater effort, deprives the brain of oxygen, and significantly elevates the risks of stroke, heart failure, and sudden death. What is more concerning is that numerous elders are unaware of their condition. Individuals may attribute their fatigue to aging or consider nocturnal awakenings as typical. However, if one snores audibly, awakens feeling lethargic, suffers from morning headaches, or has daytime drowsiness despite adequate sleep duration, these are significant warning signs. Assistance is readily accessible. A straightforward sleep study, frequently conducted at home, can diagnose the disorder. Therapies like as a CPAP machine, which gently maintains airway patency, have become smaller, quieter, and more comfortable than before. Minor lifestyle modifications, such as weight reduction, abstaining from alcohol prior to sleep, and adopting a lateral sleeping position instead of supine, can also be beneficial. Carol's narrative serves as a cautionary tale that a commonplace issue like snoring might have fatal repercussions if overlooked. Moreover, it is not only your respiration that may be irregular. Your heart may also be affected. Next, we will examine another insidious danger that disturbs your heartbeat and significantly elevates your risk of stroke during sleep. Let us examine atrial fibrillation and the reasons for its frequent oversight. 3 instances of atrial fibrillation, an abnormal heartbeat that can be fatal during sleep. A frequently overlooked factor for the deaths of many elderly during sleep is a disorder that may remain undetected for years. Undiagnosed atrial fibrillation, or AIB, an irregular heartbeat may manifest as a mere flutter or a skipped beat. Nevertheless, during sleep, this concealed electrical disturbance in the heart can abruptly precipitate a stroke or result in cardiac arrest. Nancy, a 74-year-old former piano instructor from Arizona, had always considered herself healthy. She walked every morning, consumed herbal tea, and meticulously monitored her diet. However, occasionally she experienced an unusual quivering in her chest, akin to a bird flapping its wings inside her. She dismissed it as anxiety or merely a consequence of aging. One evening, she retired to bed following a delightful dinner with her grandkids and did not awaken. Her daughter, upset and perplexed, learned from medical reports that Nancy had undetected atrial fibrillation. The arrhythmic heartbeat resulted in a thrombus formation that migrated to her brain during slumber, precipitating a lethal stroke. The unpredictability of AFib, as it frequently appears and disappears without forewarning, renders it particularly perilous. It may present asymptomatically or exhibit such mildness that it resembles benign palpitations. However, the risk accumulates with time. Blood accumulates in the heart's atria due to an uneven rhythm, heightening the risk of clot development. If a clot dislodges during the night and obstructs cerebral blood flow, an individual may experience a stroke while asleep, frequently without the opportunity to seek assistance. The CDC reports that atrial fibrillation, AFib, affects roughly 10% of Americans over the age of 65. Yet, many remain undiagnosed due to the modest or rare nature of symptoms. Therefore, routine screening is essential. Contemporary pocket ECG equipment, comparable in size to a credit card, may identify abnormal rhythms within 30 seconds. If you have ever experienced inexplicable weariness, lightheadedness, or palpitations, even once, do not disregard it. Consult your physician for screening options. If identified, treatment may involve a daily anticoagulant or a rhythm control medicine to safeguard your brain and heart during sleep. Occasionally, a seemingly minor action such as checking your pulse at home might significantly impact your health. The narrative of New York serves as a reminder that a tranquil heart may conceal latent dangers. However, what occurs when the peril originates not from within the heart, but from the medications we consume each night? This is precisely what we will examine next. The potential lethality of commonly prescribed medications when combined or administered at inappropriate times let us examine more closely. For perilous pharmacological interactions during sleep, not all nocturnal fatalities are attributable to illness. Occasionally, the medications we consume for relief inadvertently expose us to risk. Medication interactions, particularly those occurring at bedtime, are a subtle yet lethal factor contributing to several seniors' deaths during sleep. The alarming aspect of these interactions is that they often occur due to a lack of verification on the compatibility of drugs. Margaret, a 74-year-old retired school principal from Pennsylvania. Like many older folks, she had an extensive list of daily medications. One for blood pressure management, another to aid sleep, a statin for cholesterol, and a light antidepressant. Individually, the medications appeared innocuous, having been prescribed by various physicians over time. However, one evening, after consuming her routine pills with a glass of water, she retired for the night and never awakened. Her husband discovered her the following morning, and despite his astonishment, the autopsy revealed no indications of a heart attack or stroke. It was a confluence of hypotension, bradycardia, and a sedative effect that overwhelmed her system during sleep. Many individuals fail to recognize that as we age, our kidneys and liver exhibit decreased functionality, altering the metabolism of medications. A treatment that was effective at age 50 may become excessively potent or remain in the system for an extended duration by age 75. Certain pharmaceuticals, when co-administered, can potentiate each other's effects, such as beta blockers and sedatives, which may lead to perilously low heart rate and blood pressure during nocturnal hours. Conversely, agents like diuretics or anti-diabetic medications can alter electrolyte or glucose levels in a manner that becomes precarious if not monitored for extended periods. The fundamental issue resides in fragmentation. Older adults frequently consult several specialists. A cardiologist in one instance, a psychiatrist in another, yet no one individual examines the complete picture. That is where matters are overlooked. However, a straightforward remedy exists. Each senior should annually arrange a thorough medication review with a pharmacist or primary care physician. It is essential to bring all prescription bottles, vitamins, over-the-counter medications, and sleep aids to discuss each item collaboratively. Inquire specifically regarding nocturnal affects. Many common medications can provide risks when used concurrently at sleep. In many instances, altering the time to provide one dose in the morning may substantially diminish risk. It is prudent to see your physician regarding a deprescribing strategy. A deliberate and meticulous procedure of eliminating superfluous drugs from your regimen. Margaret's narrative is not uncommon. It serves as a subtle reminder that even benevolent interventions might provide hazards if scrutinized by Bowen. However, not all nocturnal perils stem from what we ingest. Occasionally, peril arises internally when our blood sugar levels decline to such an extent during sleep that we fail to awaken. Let us discuss nighttime hypoglycemia and the heightened susceptibility of diabetic elders to this insidious threat. 5 instances of nocturnal hypoglycemia, the lethal midnight blood sugar decline. A significant peril for seniors with diabetes occurs not during their active daytime hours, but rather silently throughout the night, frequently while they are in deep slumber. Nocturnal hypoglycemia refers to an abrupt decrease in blood glucose levels during sleep, and for some individuals, it may be the final event they encounter. Harold, a 69-year-old retired truck driver from Missouri, had been living with type 2 diabetes for almost a decade. He adhered to his doctor's recommendations, administered his insulin, and increased his walking regimen. However, his most significant vulnerability was late-night dining. He frequently omitted dinner or consumed insufficient quantities, believing it would assist in maintaining low blood sugar levels. One evening following his customary